Hello, hi, hi. Good evening, good morning, good afternoon, everybody, wherever you're watching us from. I hope you can hear me. And so, once again, this is Madnessing. This is our farm edition. You already know that Sundays usually we come live from here. Now, today we want to look at some medical terminologies. Have you ever felt lost at sea? Heard some things like bradycardia, like dyspnea, that you don't, I mean, you felt confused about. This live video is for you. Okay, so we we want to start off with some general terminologies. Okay, the first on my list here is acute. Acute. Have you ever heard of acute? Have you ever heard of something being acute? Okay. Anytime we say acute, it means that of a sudden onset or of a short duration. Anything acute, maybe we said the pain is acute, an acute pain, or there was acute condition, whatever it is. Then acute means that it's it is of a sudden onset or it's of a short duration. Hello and welcome. Give us a like and give us a hi and let us know where you're watching us from. We are live from Ghana. Okay. The second terminology we have here is chronic. So if it's not acute, then it's chronic. And if it's chronic, it means that it is of a long term or it has been persistent for a while. So anything that is chronic is anything that is of a long term. We sometimes hear nurses or doctors or health practitioners saying his condition is of a chronic onset, or he has a chronic diarrhea, chronic diabetes, chronic hypertension. What it means is that that condition has been there for quite some time, usually for over 3 months. Hello, Jeff. Thanks for joining us. Give us a like and let us know where you're watching us from. I think it's Jeffy. It's Jeffy instead. Thanks for joining. So we are talking about medical terminologies today. We just want to understand some terminologies we use and what they mean. Okay. So the next on our list is benign. Benign. Anytime we say something is benign, what do we mean? If you hear a health practitioner saying benign, it means that that particular thing they are describing is not cancerous. Okay, if it's benign, it's not cancerous. You can hear something like a BPH or a benign prostatic hypertrophy. Anytime you hear benign prefacing any condition, it means that that condition is not cancerous. Okay, so if it's cancerous, how do we describe it? We say it is malignant. Malignant. If it's cancerous, it's malignant. Okay, thank you, Mac Maxonaleste. I hope I got your name right. I I don't understand your language, but thank you for joining. Okay, thank you. Let us know where you're watching us from and you can give us a hi. So we are live from Ghana. This is Smart Nursing. It is a nursing tutorial channel, and usually on Sundays we come to the farm, and so most of the time we come live from the farm. Linda, your name is Linda. Okay, thank you for joining. Today we are talking about medical terminologies. Okay, so the next one we have here is idiopathic. Idiopathic. Anytime we say anything is idiopathic, it means that the thing is unknown. Idiopathic, it means unknown. Maybe we say that hypertension has an idiopathic cause. Then it means that whatever causes hypertension is not known. Okay, that is what idiopathic means. Okay, how about pathology? Pathology. When you say pathology, it means the study of a disease and its effect. A pathology is a study of a disease and its effect. That is how come the people who carry, what will I say, examinations on certain tissues to see what is causing it are called pathologists. Or people who do post-mortem, they carry out examinations, they carry out assessment on dead bodies to find out whatever cause their death are called pathologists. Okay, so pathology is a study of a disease and its effects. Okay, I hope you were liking the video so far, and we are grateful that you joined us. And so we continue with our medical terminologies. Once again, this is Smart Nursing, and my name is Nurse Evie. And today we are just going over some medical terminologies we use and what they stand for. So how about diagnosis? How about diagnosis? What does diagnosis means? Diagnosis simply means identification of a disease or a condition. Hello, namaste. Namaste, Biswal. Namaste, my Indian friends. Thank you so much for joining. I'm really grateful. Namaste. Okay, so diagnosis, like I said, it means identification of a disease or a condition. Most of the times when you visit a health facility with symptoms or with problems, things are put together. The symptoms that you present, they do some examinations, they do some clinical investigations or labs or images like scans, like x-rays and all that. Thank you so much. I'm grateful. Thank you. Thank you, Biswa. Thank you. So we put all that together and we come up with a diagnosis, which is whatever is causing your problem. So that is what the diagnosis means. It simply means identification of a disease and or a condition. Okay. So what is a symptom then? It is a subjective experience reported by a patient. What is a symptom? A subjective experience reported by a patient. So a patient visits a health facility and complains about a headache, complains about dizziness, complains about a chest pain, complains about abdominal pain. That means a symptom. So this while we are going over some medical terminologies you hear, medical terminologies we use. We are just going over some of them and what they mean. Basically, that is what we are doing today. We have done a number of them already, and so we are just continuing with some other ones on our list today. Thank you. Thank you. I really cannot. Yeah, Maxona Leste. Thank you. Okay, thank you. All right. Then what is a sign? So a symptom is a subjective one. That is what the patient will tell you is what is wrong with me. But a sign is an objective one that the health practitioner will elicit from the patient. An example of that will be temperature. Okay. I'm a nurse actually, Biswal. I'm a nurse. I'm not a doctor. Yes, I'm a nurse. Thank you. Yeah. So a sign is an objective evidence of a disease observed by others. Okay. So a seizure is a sign. The patient cannot tell you, but you can see the patient having a seizure. Okay, that is a sign. And then something like a temperature. When I check your temperature, whatever I get is a sign. Okay, by you telling me you feel hot is a symptom. So a symptom is what the patient will tell you, and a sign is what you will find out from examinations or assessment on the patient. Okay, right. Next on our list is remission. What is remission? What does remission means? It means that there's a decrease or there's a disappearance of a symptom. This usually happens in people that have chronic diseases or what we call autoimmune diseases, where your own immune system is attacking your system. There are people who have diseases like asthma, like gouty arthritis. Okay, such conditions cannot be cured totally, but they go and they come. So they have periods where they are not in any pain or they are not feeling anything, and then there are periods that they get what we call exacerbation or worsening of their problems. Okay, so remission is the time when your symptoms reduce, they are minimal, or you don't see any symptom at all. Yes, Biswa. Thank you. Thank you. Okay. Now, a relapse is a return of a disease after improvement. I'm from Ghana, Biswa. I'm from Ghana. I'm currently live from Ghana. Thank you. All right. So, a relapse is a return of a symptom. So, from a remission, you get a relapse. Okay. From the period where you don't have any pain, then you have a relapse where you get a lot of pain. Okay, so far these are some general medical terminologies that we use, and then you know, their meanings. Okay, so let's get a bit specific. Okay, let's see if we can take them one after the other. So let us look at our gastrointestinal system. Hello, Boniface. Hello, Boniface. The time here is actually 5:43 p.m. It's 5:43 p.m. in Ghana. What says your time? And where are you watching us from? Boniface. Looks like you're Nigerian. I'm not so sure. The time is 5:45 p.m. So let us know what your time is and where you're watching us from. Okay. And give us a like, guys. Give this video a like. Give us a shout out. Okay. Oh, Kenya. Oh my goodness. Wow. You're you're actually more than 3 hours ahead of us. Wow, that is wonderful. I love Kenya. I like the fact that you guys are so athletic and you win all the tournaments, all the running tournaments in the world. I'm so glad and proud of you guys. Thank you, Budface. Thank you for watching. Yeah. Yeah, I know. India is 11, 17. I've been to India, you know. I've been to India. I love Indians. Oh, I'm so glad you're watching, Boniface. I'm so glad. This channel is actually meant for you guys. So we talk about everything nursing. We go into topics that sometimes seem a bit difficult to understand in the class, because I have been a victim of such. Okay, I've been a nurse for almost 2 decades now. I've been a nurse since 2010, and then throughout my my education, I had to struggle. I had to do a lot of, self-learning to be able to understand certain things. So I thought it wise to probably share my ideas. Most of the time sharing, group discussion, peer-to-peer reviews are always better. It gives you different angles to, a condition. It gives you different angles to a topic. Okay, so videos like this actually help me through my studies and through exams that I had to write. So I thought wise to also share what I have. Okay, so I'm very, very grateful that you're nursing students and you're joining me today. I'm so grateful. Okay, maybe one day we'll see each other in Kenya. Yeah. Oh, India. I'll come back again. I actually have a friend there in India, and so I'll be coming. I'll be coming. And please prepare to get um some pani puris down for me. I like pani puri a lot, okay, in all the flavors. All right, so let's continue with um with our gastrointestinal. Okay, why don't we start off with some cardiovascular terms, okay? Let's continue with some cardiovascular terms. And then we have hypertension. What is hypertension? Anytime we say hypertension, it simply means high blood pressure. Hypertension simply means high blood pressure. And in that regard, a hypotension means low blood pressure. If it's not high, it's low. So if it's not hyper, it's hypo. So anytime you hear a prefix with hyper, you know we are talking about high or we're talking about fast. And you hear anything about hypo, then we're talking about low or we're talking about, slow. Okay. So bradycardia also means a slow heart rate. And what is our normal heart rate? Maybe Boniface can help us. Since Boniface is a nursing student, Boniface can help us with a normal heart rate value. Is Boniface still here? Great! Oh my goodness, that is so good. Yeah, so our normal heart rate is 60 to 100. Great work, Boniface. So glad you get it. So if it's lower than 60, then it's a bradycardia. And if the heart rate is more than 100, then that is what's a tachycardia. Okay, so anytime you hear bradycardia, it simply means the heart rate less than 60. Anytime you hear a tachycardia, it simply means heart rate more than 100. Okay, thank you, Boniface, for that one. Now let's talk about arrhythmia. Okay, anytime you hear arrhythmia, it means an irregular or an abnormal heart rhythm. Okay, an irregular or an abnormal heart rhythm. We actually have an ECG series ongoing on our Smart Medicine channel, and then you guys can, take time out, go through them. We've been taking the pains to explain ECG as best and smart as we can, and we've talked about what a sinus rhythm is. We've talked about normal rhythms. We've talked about the cardiac conduction pathway. We've talked about, calculating heart rate on ECGs and a whole lot on on our channel page, and so you guys can check that out. Okay. So, wow, yeah, 78 is very normal. 78 is a very normal heart rate. Okay. So anything between 60 to 100 is a normal heart rate. Okay. So an arrhythmia, like I was saying, is an irregular heart rhythm. An irregular or abnormal. We have rhythms that we refer to as fibrillations. You can have ventricular fibrillations, you can have ventricular tachycardias, you can have atrial fibrillations, atrial tachycardias. We have rhythms that we call um you know irregular. We have so many rhythms. Some are supraventricular tachycardia, some are atrial tachycardia, some are fibrillations. All those things are arrhythmias. They all have ways of managing them, okay? And so watch out for that on our channel. We will be talking about arrhythmias and their management, okay? Thank you guys for joining so far. And I can't see the likes, guys. You're not giving us likes. Give us some likes, okay? So what is a myocardial infarction? It simply means a heart attack. Myocardial infarction means heart attack. We actually have an upcoming video on myocardial infarction, or what we call acute coronary syndrome. Okay, it actually have three components in there. It's unstable angina, it's NSTEMI, or non-ST elevation myocardial infarction, and we have ST elevation myocardial infarction. Okay, we have an upcoming video on that. I think somewhere next week that video should be out, or within the week it should be out, so watch out for that. So a myocardial infarction simply means a heart attack. But there are types of heart attacks, and there are pathophysiologies we will explain in that video. All right, so watch out for that. Of course, Beswao, of course. Mental health is optimum. Mental health is the best way to go. If you're not healthy mentally, then even your physical health will be affected. Our mind is always what controls our actions, and so if there is no peace of mind, then you can't work, you cannot be productive, you can't take care of your families, you can't take care of yourself, and so you cannot be healthy. Okay, so it is very, very important to take our mental health very, very seriously. You can visit the clinic anytime, talk to a specialist, talk to somebody who has an idea, talk to someone who is experienced if you have issues. Okay, if you don't have anybody around you, always make time, get friends, go out, talk to people, discuss about your issues. You don't have to tell everybody whatever is going on with you, but do not always keep it to yourself. Don't, enclose yourself in a corner. Come out, talk to people. Okay, there are so many tests that you can take, that they can conduct on you. There are so many questionnaires that they can conduct on you and see if you have any stress level. They will have a way of taking care of you, so you don't need to degenerate into a point where, nobody can do anything about it. Please take your mental health very, very seriously. If you're a busy worker, always make time to take rest. Sleep and rest, very, very important. They're very paramount to a healthy mind and then a healthy body. Always make time to rest. Okay, set alarm clocks on your phone or your devices, whatever you use. Take time to rest, guys. There's a saying that all work and no play makes Jack a dull boy, but all work and no rest makes Jack, not healthy. I will put it that way, okay? So you need to rest, okay? Don't always think about working and don't always think about money. Yeah, so yes, Biswell, if you have a stroke, which I think by stroke you're talking about, you know, a CVA or cerebral vascular accident, depending on the type that you have, and then its management, because we have one that is ischemic, one that is like blood flow going to your brain is reduced, okay, that is ischemic, then it will lead to some part of the brain getting ischemic and then they will die. Or yeah, Boniface, your teacher may be right, because too much money actually affects the brain. Not everybody can handle money. Some people get, confused. Some people get confused at the sight of money. They don't know what to do with money. They start to misbehave. They eat anyhow. Most at times, that is the problem with the rich. Okay, if you follow some particular conditions, okay, some chronic condition, you realize that it's as though it is associated with, yeah, it's as though it's associated with the rich than the poor. And most at the time, they have this cholesterol issues and they have a lot of heart issues because they don't eat healthy, right? Because there's too much money, they order anything they like. They are not checking the diet. They are eating a lot of junk food and they are going out and they're eating this and there's that and a lot of fatty, meat, okay, unhealthy diet. They don't plan their diet and all that. So you may be right. Too much money can, too much money can affect the brain, okay? But what can you do? It doesn't mean that, money, they say, is the root of all evil. But it's also a good master. It can be a good master, but also a very stubborn servant. But we still need money to survive. And without money, there'll be no food. Okay, but reasonable money, it's good. All right. So if you get a stroke and you're recovering, one of the ways that you can do that to keep, because most of the times you get a stroke, then some part of your body is affected, your muscles are weak there, and so you need to do a lot of exercise, a lot of physiotherapy. You need to keep up on your diet, and you need to keep up on your hospital appointments, and you need to continue with your medications that were prescribed for you. Okay, because the fact that you had another one means that you can easily get, the fact that you had a first one means you can easily get another one, and we want to prevent that. Usually the second one tends, the subsequent ones tends to be, more worse or a lot more worse compared to the previous. Okay, so if you are recovering person from stroke, just keep up with your hospital appointment, listen to your doctors because they assess you and they know what they have seen. Together, you devise a plan that works better for you, that is suitable, that is tailored to your needs. Okay, so always continue with your hospital appointments. All right, so if we want to continue with our cardiovascular um terminologies, guys, with our cardiovascular terminologies, then our next will be money handling as well. It's an act. Yeah, money handling is an act. Not everybody can handle money, so you need to actually hire people to teach you how to manage your money. Okay, not everybody can manage money. All right. Yes, so we are continuing with our cardiovascular terms. Okay, and then I spoke about ischemia earlier. Anytime you hear ischemia, it means that there is reduced blood flow to a particular part. Ischemia means reduced blood flow. I said something earlier that a stroke type is called an ischemic stroke because that stroke comes from the fact that blood supply to the brain is reduced. Blood supply to the brain is reduced. Okay, we have that also in heart attack. When the blood supply to a part of the heart is affected, then it's called ischemia. Okay, so anytime you hear ischemia in in anything related to health, it means reduce blood supply. Okay, how about all right. What? Yeah, so that is a nice one. Okay, let's look at some renal or genitourinary terms. When we say renal or genitourinary, we're talking renal, anything renal. So anytime you hear renal, it means the kidneys, okay? Anything renal has to do with the kidneys. Genital urinary means your genitals and your urethral or your urinary system. So your kidneys, your genitals, and your urinary system. What are some of the terms we use there? The first one here is hematuria. Hematuria or hematuria. That means blood in your urine. Okay, anytime you hear hematuria, it means blood in your urine. There are some urinary conditions that manifest as blood in your urine. For example, a very severe UTI can do that. Or if the person has a BPH, we spoke about benign earlier, a benign prostatic hypertrophy or a swollen prostate. Simply put, the patient can bleed inside the urine, and that is known as hematuria. Okay, thank you guys for watching so far. I think Boniface is still here. Hi Boniface, hi Besua. Thank you all for staying. All right, so how about oliguria? Oliguria means low urine output. Oliguria means low urine output. And anuria means no urine output. Okay, no urine output. All right. Now, dysuria. Dysuria. What does dysuria means? Dysuria means painful urination. Painful urination. You want to urinate or you want to pee and it's so painful. That is what we call dysuria. All right. Diuresis means increase in urine production. Diuresis means increase in urine production. The patient urinates more or produces more urine than it should. Does anyone know the normal urine output? The normal urine output is actually 0.5 to 1, per kg per hour. So if you're using one and then you're 70, then within an hour you should have like 70 mils of urine. Okay, so it's actually calculated per kg body weight. Okay, and there's a constant in there for people. So anybody that has urine produced lower than that will be referred to as oliguria. Okay, no urine at all is anuria. Diuresis is you are just too much urine. Okay, and there are conditions that manifest at that. Then we have what we call UTI. UTI simply means urinary tract infection. Okay, UTI means urinary tract infection. All right, nephritis. What is nephritis? Nephritis means inflammation of the kidneys. Okay, inflammation of the kidneys. So itis, anytime you hear that word itis, itis, it means inflammation. Okay, it can be inflammation of anything. Oh, yes, 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 yes. Sorry about that. I checked that. Yeah, so Boniface, the reason is simply that anytime you see bubbling, it means the presence of air. Okay, anytime you see bubbling, it means the presence of air. So when you're connecting an IV piggy bag, you always make sure you clear the dead space. You flash the given set, clear all the bubbles throughout, dispose it into something else before you connect it into the IV cannula of the patient. If not, you're going to send an air emboli. An embolus is anything that travels, anything that is um foreign, okay, anything that is foreign to the body. You can have an air embolus, you can have a fat embolus, okay. So if you allow the bubbles to go through the given set, through the IV cannula into the patient's veins, then you're going to send air through the cardiovascular system into the lungs of that patient, okay. It can go into the lungs and cause a pulmonary embolism. It causes a pulmonary emboli if it has gone to lodge inside a very large area in the veins. Maybe it's going to block. Sorry, it's going to block the areas inside the lungs. Okay, if it's blocking the trachea, or it's blocking the bronchi, or it's blocking the bronchioles or the alveoli, then you can cause a pulmonary embolism, which leads to death. Pulmonary embolism usually is incurable because it's death. Okay, that is why we are always very, very careful when we are connecting IVs. Whether you're given an IV medication or you're given an IV fluid, an IV piggy bag, whatever it is, IV, any parenteral at all going through the, IV cannulation of a patient, you need to make sure that it does not have bubbles inside. Okay. I hope I hope that helps, Boniface. And so it's very, very important, and your nurse in charge was very right about that. Okay. So let's talk about dialysis. When you hear dialysis, what does it mean? When you hear dialysis, what does it mean? Dialysis means, artificial blood simply. Dialysis means artificial kidneys, taking patient through a machine that has an artificial kidney that washes through your blood. Okay, it's not artificial blood. It's an artificial kidney that, oh, come on, Boniface. Don't be, demoralized about all this. That is why we, there's always a supervisor, because they know that students are still learning and you still have to practice before you learn. If you don't practice, how do you get experience? Okay, so there's always someone to there's always somebody who supervises, who is watching over you, and is supposed to show you all those things. Okay, don't look at it from that angle. All right. Okay, let's look at some diagnostic and monitoring terms. Some diagnostic and monitoring terms. When we say vital signs, we mean that basic indications of a patient's state of health or state of well-being. Basic indications, okay, like temperature, blood pressure, heart rate, pain, what else, SpO2, respiration. Okay, those are the vital signs. Those are the basic things that can tell you a lot about how a patient is faring. Okay, vital signs They are basic, but they are so very important. They speak volumes about your patient's health. So always make sure that you take that vital signs very seriously. Count your pulse, palpate them for 1 minute all through. Palpate your pulses. Don't always rely on machines, okay? Palpate them. It is only when you palpate your pulses that you'll be able to tell their rhythm, and you'll be able to tell their consistency, and you'll be able to tell whether they are of full volume or they are not of full volume, okay? Whether they are weak or strong, whether they are thready, whatever it is, you can only tell after you have palpated. All right, so always make sure to palpate your pulses and take your so always make sure to palpate your pulses and then take your vital signs very seriously. Now, have you ever heard CBC? Have you ever heard CBC? CBC means complete blood count. Okay, CBC is a lab investigation that we take your blood sample to the lab and then we run tests on it. Okay, when you do a CBC, it will give you values, it will give you other places. It's called a full blood count. Okay, you will see your white blood cells, your red blood cells, your neutrophils, your eosinophils, your platelets, so many, all the components of your blood will be run during a CBC. Okay, we will have a video where we explain CBC into details. Okay, all right. So what is an MRI? MRI simply means magnetic resonance imaging. It's an advanced form of imaging where, nitty-gritties of your system or your tissues can be assessed. It's a very strong imaging. Okay. Now, a biopsy is a sample of a tissue for diagnosis. So often during certain conditions, we take biopsies to the lab, and then a pathologist, as we discussed earlier. So we have a guest here who is singing. What do you want to say? You don't want to say anything? Okay.
I want to do my own verse.
Okay. So go and but now I see venue. Oh, sorry, get up. When I see venue on watermelon na miss ya. Ele can medi ne kwani wa la mi sia.
Let us sing it.
Ebe?
Let us sing
Yeah. Mm-hmm. Okay, guys. Sorry about that. So that's my son. All right. So if you're just joining us, this is Smart Nursing, and we are live from Ghana. We are live from our farm today because it's Sunday, and those who have been following us for a while are already aware that we come to the farm usually on Sundays, and we do some farm work, and we also discuss some nursing. So today we are just going over some medical terminologies and their meaning. Okay, so that is that. Let's continue and look at some oncology or some hematology terms. Oncology or hematology terms. Oncology means the study of, cancer, okay? And hematology will be the study of blood. Okay, so if you just join us, kindly give us a like, give this video a like, and encourage us to keep coming to you guys. Okay, so what is anemia? Anemia is a low red blood cell count or hemoglobin. Basically, sorry, basically our hemoglobin is what gives us our blood levels. Okay, so if you have anemia, it means you have a low red blood cells or you have a low hemoglobin. Leukemia means blood cancer affecting your white blood cells. If you have a cancer that is affecting your red blood cells, it is called leukemia. Then lymphoma is a cancer of the lymphatic system. A lymphoma, I'm sure you've heard of a Hodgkin's lymphoma before. That is a lymphoma that Hodgkin has discovered. A lymphoma is a cancer of the lymphatic system. Okay, all right. Now, metastasis. What is metastasis? It simply means the spread of a cancer to other parts. So maybe you had a breast cancer and it has spread to your lungs, or you have a cervical cancer and it has spread to your breast. Okay, that is what we call metastasis. Right. Now, what is thrombocyte? What is thrombocytopenia? Thrombocytopenia, if you've ever heard of thrombocytopenia, it means that there are low platelet levels in your blood, low platelet count in your blood. That is what we call thrombocytopenia. Okay, thrombocytes are platelets. Platelets are thrombocytes. Okay, yeah. Now, hematocrit is a proportion of your red blood cells inside your blood. I think it's about 1/3 or so. There's a calculation for that. So hematocrits are a proportion of your red blood cells in your blood. All right. How are you guys doing so far? How are you doing so far? Do you have any questions, any more questions to ask? Who is still here? We are so grateful for you joining. Is it Boniface still? Thank you so much. Thank you so much for joining. Okay. So let us continue. Let us continue with some common abbreviations. Okay. Let's continue with some common. Okay, guys. Thank you. Thank you. Thank you for joining. So we are still here and we want to look at some common abbreviations. Okay, I'm sure when you find some medication prescriptions, you will see some things like TDS or TID or BID, BD, PRN, all that. What do they mean? Okay, anytime you see a TID, it simply means 3 times daily. So take this medication 3 times daily. Maybe it's tablet paracetamol or tablet Tylenol, 1 gram TID for 3 days. It simply means take 1 gram of the tablet 3 times a day for 3 days. Okay. If you see BID or BDS, it means 2 times a day. Okay. Anytime you see that, it means 2 times a day. Anytime you see PRN, that means when necessary. So take your medications whenever it is necessary. If you see an abbreviation of PO, it means per os or per mouth. So take your medication orally. Okay. Now let's go ahead and look at some anatomical terms. Let's look at some anatomical terms that we use in healthcare. If you see anterior, what does it mean? Something is anterior. It means that in front of you, in front of the body, in front of the patient. Okay, like right now, my camera is anterior to me, it's anterior to my face, and so the camera is in front of me. Okay, so anterior means in front of. Now, posterior means at the back. So, posterior means at the back of the body. Okay, so for example, my spine is posterior to my body. My scapula is posterior to my body. Okay, those grasses behind me are posterior to my body. All right, okay. Now, what does superior means? Superior means above or higher. Anytime you hear superior, it means above or, you know, higher. And then inferior, on the other hand, means below or lower. Okay, so to give you an example, the heart has two large vessels that carry deoxygenated blood into it. The right atrium receives deoxygenated blood through two large veins. Okay, it makes the heart to sit in between those two veins. One is above it and one is below it. So the one above is called the superior vena cava, and the one below is called the inferior vena cava. You understand? So anything below or under is called inferior. Anything above or higher is called superior. All right. Now, what does medial mean? Medial and lateral. So anytime we are talking about medial and lateral, we use the midline of the body. You divide the body, you put an imaginary line through the body this way, midway. Okay, that is usually the reference point. So if we say something is medial to you or to your body, it means towards the midline. Okay, it is towards the midline. For example, my shoulder here is medial to me. My shoulder is towards the midline of my body. Okay, so my shoulder is medial. All right. Now, if we are talking about lateral, if we say lateral, lateral means that it is away from the midline. Anytime we describe something as lateral, that thing is away from the midline. So my hands, okay, is lateral to me because it is far away from this imaginary line that we have drawn here, guys. I hope you're following and I hope it's making some sense. Okay, then let's talk about proximal. Proximal also means that it is closer to the point of attachment, and then distal means it is farther away from the point of attachment. An example is that if you take this arm, and then this angle here is the attachment, or this joint here, this shoulder joint here is the attachment, then you can say that this bone, which is called the humerus, or this part of my arm, is proximal to this joint. Okay, but then the wrist and the palm is distal from the joint. So when you're talking about something being proximal or something being distal, you always have a reference point. Okay, you always have a reference point. These things are used to describe you know issues or describe parts of the body in assessment. Okay, now to continue, we have distal. We're talking about distal, and then we have superficial. Okay, we have superficial. So anytime you see us use superficial, it means that it is closer to the surface. Maybe somebody has a wound and we describe the wound as just being superficial. It means that the wound is just on the skin here. It hasn't gone deep inside. If it is farther away from the skin, which is on top, then we say it is a deep wound or a deep laceration. Okay, so if you're just joining us, this is Smart Nursing and we're live from Ghana, Africa. We are just discussing medical terminologies. We're just talking about medical terminologies today and their meaning. We actually are live on the farm every Sunday, and this is just one of them. So if you're joining us for the first time, or if you're now joining us, give us a like and let us know when you are watching us from. Boniface and Biswa has been so um what do I say, accompanying today. Thank you so much for being with us. Okay, so let us proceed and talk about some endocrine or metabolic terms. The first we have here is hyperglycemia. Anytime you see hyperglycemia, it simply means high blood pressure. Okay, hyperglycemia simply means high blood pressure, and hypoglycemia simply means low blood pressure. If you're just joining us, kindly give us a like. Give us this like. Give this video some like. Okay, encourage us to keep doing this. So, like we said earlier, anytime you hear hyper, it means high, and anytime you hear hypo, it means low or slow. Okay, so hyperglycemia means high blood pressure, and hypoglycemia means low blood pressure.
Mama, black
Okay,
Kelechi.
okay. Tell whenever that's a face up, face net charge now.
Mama, oh,
Coin net charge now.
you? Nam plucky.
Elego. Not easy, guys. Parenting everywhere. Okay, so what is diabetes mellitus? What is diabetes mellitus? Diabetes mellitus means any chronic condition of poor glucose regulation. It's simply a chronic condition of poor glucose regulation. Okay, so we will talk about diabetes mellitus. We have types of diabetes. Okay, it means poor glucose regulation. There's diabetes insipidus. All right, but we will talk about all that later in a detailed video. But anytime you hear diabetes mellitus, it means a condition of poor glucose regulation. Thank you for joining. Okay, you're welcome. And if you're just joining us, we are talking about some medical terminologies we use today and their meanings. And we are live on the farm from Ghana, West Africa. Okay, it's approximately 6:30 p.m. here in Ghana. I would love to know your time. I know you'll be doing 9:30 there in Kenya. That will be for Boniface. Okay. All right. So ketoacidosis, what does it mean? It means there's an acid buildup due to fat metabolism. Okay. There's an acid buildup in your body due to fat metabolism. So in diabetes, when the body doesn't have energy to work with, it will fall on the fatty tissues that you have, break them down so they can generate that ATP to work with. And that, at the end of the day, will produce an end product called ketones. Those ketones will get accumulated in your body, and then they will become harmful to your body. They lead to the condition we call ketoacidosis, which the ketones have caused acid to be, to have build up in your body. Okay, guys, it's let's talk about electrolytes here. And these are mineral ions like sodium, potassium, and calcium that have built up in your, that is very important minerals to be considered. At this
Mama,
point, so at this point in time,
only for me.
I think that is my cue that we have to end it here. But we will see you again on Sunday. We will see you next week Sunday, God willing. God willing, next week Sunday, we will
Mama,
meet again and we
when
will have a discussion
Mama,
again
maybe
to continue with our medical terminologies and what they stand
that is
for. Thank you so
only
much
for
for
me.
joining us from
Only,
India, from Kenya, from
that's
across the
only,
world.
only.
Thank you so much
No,
for
the
joining
light is not
us.
only. See the
We
light. The light is not only.
we will see you again another time. I'm so grateful to Pesma. I'm so grateful to Boniface for joining us. Namaste, my friends. See you another time. Bye bye.